It's interesting, but these days we're suggesting to all our patients that instead of transferring their fresh embryos in that fresh IVF cycle, they actually freeze all their embryos and then transfer them one at a time in a thaw cycle. A lot of patients don't understand, oh, won't the embryo get damaged as a result of the freezing? And the good news is it will not, because we're using a process called vitrification, so the survival rate is 100%. We don't waste any of your embryos. Why do we suggest a frozen thaw cycle? And the reason is that in a fresh cycle, our priority is to make you grow eggs, not so much to prepare the endometrium, so that even if we get great quality embryos and your endometrium looks perfect, often the endometrium is not as receptive as it would have been. Whereas once we've frozen your embryos and then transfer them in a thaw cycle, we can optimize your endometrial receptivity, which is why you're putting a top quality embryo in a top quality endometrium. And pregnancy rates are obviously going to be better as compared to putting top quality embryos in a poorly prepared endometrium, which is what is typical in a fresh cycle. Yes, it's important that you have a good quality clinic which has a great freezing success rate, and you need a full-time embryologist who has a lot of experience and expertise. But this is now the standard trend all across the world. If you have questions, please feel free to ask me. I'm Dr. Malpani. My website is www.drmalpani.com. I'm happy to offer a free second opinion, and we look forward to helping you to have a baby.